Artificial Intelligence Doctor. User question. Which biomarkers are most predictive of cardiovascular events in elderly patients with poorly controlled diabetes? GPT-01 answer. Thought about biomarkers for cardiovascular events for 6 seconds. Several categories of biomarkers have been investigated in the context of predicting cardiovascular events in elderly patients with poorly controlled diabetes. While no single biomarker provides a complete picture, certain markers have demonstrated stronger and more consistent associations with cardiovascular risk in this population. Cardiac-specific biomarkers. High-sensitivity cardiac troponins, HSDNT, HSDNI. Elevated levels of cardiac troponins, even those previously considered normal with older assay methods, are strongly predictive of future cardiovascular events and mortality. In elderly patients with diabetes, persistently elevated HS troponins indicate ongoing subclinical myocardial injury and heightened vulnerability to ischemic events. Natriuretic peptides, BNP and NT-proBNP. BNP and NT-proBNP levels rise in response to increased ventricular wall stress. In diabetic elderly patients, especially those with hypertension or left ventricular hypertrophy, elevated natriuretic peptides strongly predict heart failure, atrial fibrillation, and other cardiovascular events. Inflammatory markers. High-sensitivity C-reactive protein, hsCRP. Chronic, low-grade inflammation is central to atherosclerosis progression. Elevated hsCRP has repeatedly been linked with heightened risk for coronary artery disease, stroke, and peripheral vascular events. In patients with poorly controlled diabetes, where glycemic dysregulation intensifies oxidative stress and vascular inflammation, hsCRP further refines cardiovascular risk stratification. Interleukins 6, IL-6, and other cytokines. Although less commonly used clinically than hsCRP, IL-6 and related cytokines are upstream mediators of inflammatory pathways, contributing to plaque instability and endothelial dysfunction. Higher IL-6 levels can correlate with increased cardiovascular risk, especially in older diabetic individuals. Biomarkers of renal and endothelial dysfunction. Albuminuria, microalbuminuria. Microalbuminuria reflects early endothelial dysfunction and microvascular damage, which are frequent in long-standing or poorly controlled diabetes. Numerous studies show that even mild elevations in urinary albumin excretion predict cardiovascular morbidity and mortality, helping identify those at higher risk of events such as myocardial infarction or stroke. Cystatin C and eGFR decline. Renal insufficiency itself is a risk factor for cardiovascular disease. In elderly diabetic patients, elevated cystatin C and decreasing estimated glomerular filtration rate, eGFR, indicate kidney impairment, which correlates with accelerating atherosclerosis and worse cardiovascular outcomes. Metabolic and glycemic control indicators. Glycated hemoglobin, HbA1c. Although HbA1c is a cornerstone measure of long-term glycemic control, its predictive specificity for cardiovascular events is somewhat less direct than markers of cardiac injury or inflammation. Nevertheless, persistently high HbA1c levels in older diabetic patients do correlate with increased macrovascular complications and cardiovascular risk. Advanced glycation end products, AGEs, and their receptors, RAGE. AGEs accumulate more rapidly with poor glycemic control and promote vascular stiffness, inflammation, and endothelial dysfunction. Elevated AG/RAGE signaling has been implicated in accelerated atherosclerosis, although these are not yet standardized clinical biomarkers. Lipid-related biomarkers. Apolipoprotein B and non-HDL cholesterol. Beyond traditional LDL and HDL measurements, ApoB and non-HDL cholesterol can help refine cardiovascular risk, though their predictive value, while important, is typically supplemented by other markers in elderly diabetic populations.